Good afternoon, everyone. I'd like to welcome you to the Caregiver Foundation's monthly Caregiver Support Group. It's my honor today to introduce Gary Powell, the Executive Director of the Caregiver Foundation. Gary?
Welcome, everyone. We're really glad that you could join with us today, and we're especially glad that Dr. Tom Harding can be with us. Dr. Harding is the director of the Maui Memory Clinic, among other things, and one of Hawaii's best resources when it comes to dementia and brain disorders. And we're really glad that you could join us today. And I'll turn it over to you, Dr. Harding.
Thank you, Gary, and thank you for allowing me this opportunity to talk about this topic that I think is on a lot of folks' minds, and that's this COVID brain fog. If I want to share my screen, do I just press the share screen button at the bottom?
Yes, you just go ahead and press that button and then select which portion of your screen you'd like to share.
How's that? Does that come out?
Yes, that's perfect.
Okay. And hopefully I can, it'll allow me to scroll through this presentation. Let's just see if that will do. Aha, yes, it is going to allow this. Okay, so what we're going to talk about today are the cognitive complications of COVID-19, or if you're here listening to the news, they're talking about folks that have brain fog. And originally I was told I was going to have about 20 minutes, and there's a lot of information to cover in 20 minutes. So I'm just going to talk about the basics to give a general overview of the different mechanisms and how it can end up affecting brain function. I'm going to try not to use complex medical terminology. I'm going to try to use simple language. But even doing that, it's going to be a bit of information. So just strap in and hang on, and we'll go ahead and get started with this. The best way to think about brain function is you have to think about the brain, the heart, and the lung circle. So if you've got a healthy heart pumping lots of oxygen and blood up to your brain, you're going to have optimal brain health. Now, as you know, COVID's affecting organs in the body, and so it's going to affect brain function in different ways. And I like to use graphs. So when you think of brain function, think of this blue line right here going down, okay? And what's making it go down are these things on this red line, and you'll see it say stress and things of that nature. But what we want to think about today is inflammation. So if you've been listening to the news, you've been hearing about a cytokine storm. And so that's inflammation. So as this red line of inflammation is going up, our brain function is going to be going down. So COVID brain fog has recently been given a new acronym that's called post-acute sequelae of COVID or SARS, or PASC. Most folks still call it brain fog when they go to the doctor's office. And symptoms of brain fog include attention problems or difficulty focusing, memory loss or confusion, word finding problems. Just about everyone that gets COVID has fatigue, and then there's mood disorders. And lots of folks after COVID are saying that the brain fog is impairing their ability to work and function normally. So let's dive into some of these pathways and mechanisms. And I'm going to try to group some of these together, like these yellow ones here. Viral respiratory infection, ARDS, that's acute respiratory distress syndrome. If you've been watching the news and they're talking about people on ventilators, they most likely have the ARDS. And then part of, when you talk about lower lung function, that we have to talk about hypoxia, or reduced oxygen to the brain. So as you probably are aware, COVID starts when you inhale the virus and it gets into your lungs. And once it's in your lungs, it can, you get this immune response. Now, normally your immune response is nice and balanced. So for example, if you sprain your wrist and it's going to swell up and it's going to be stiff and hard to move that wrist, and your body's designed that way because when it hurts to move it, you won't use it. So it allows it's called localized inflammation, and it's doing its job. It's trying to hold it still so you don't use it and it can heal. But when we're talking about COVID, it's coming in here, and this immune response is in overdrive. It's in the red zone. It's overproducing. There's the COVID is making the inflammation rise to levels that is abnormal or dangerous, and it can actually damage healthy cells. And so that's going to start in the lungs, and it's going to come to the alveoli. The alveoli, think of it, just call it an air sac. There's teeny little air sacs in your lungs. And what they're doing is when you breathe in oxygen, it comes into your air sac, and it's going to transfer that air into your arteries. And then your arteries, when you exhale, what's going on is the carbon dioxide that's building up in your bloodstream exchanges, and it comes out into the alveoli or the air sac, and it leaves your body. So when it's nice and healthy, the air sac is ready to do its job. But with COVID over here, what's going on is this inflammation response that we're having. We're getting this buildup of edema or fluid. And as these air sacs build up with fluid, it's not much room in here for air. And so people, who are in the hospital are saying, I just couldn't breathe. I felt like I was drowning. And literally there's just not much room in there for the air. And for folks who've never seen a COVID lung, I wanted to put this up here just to kind of remind you, we're starting to get our vaccines in place, and people are starting to relax a little bit about wearing their masks and social distancing. And I would advise against that. This is a healthy lung, and this is a COVID lung. Obviously, this is a very severe case, and this person passed away, and this is an autopsy, but this is the damage that can be done by COVID in your lungs. Now, obviously, you were not getting a lot of airflow, and so let's talk about hypoxia in the hippocampus. And hypoxia is a word for reduced airflow, or reduced oxygen, I should say. And the hippocampus is this yellow place right here. This is a side view. This is the left side of your brain. Here, these are your eyes. So we're looking at the face. You can see that there's a hippocampus in both hemispheres of the brain. And this is the part of your brain that's responsible for short-term new learning, new memory. So when people say that they're having trouble with memory, they're not talking about long-term memory. They're talking about remembering a grocery list, or when do I have that appointment? I can't find my keys. Has anybody seen my wallet? I can't find my wallet. So short-term memory is being impacted because the hippocampus right here, very susceptible to low oxygen levels. It's one of the first places that gets affected by low oxygen levels. And that's part of the reason why people are having trouble with memory when they have the COVID. So let's talk about hyposemia. This is a fancy word for saying the reduced sense of smell. Many people complain about the reduced sense of smell. And so what we have here is a side view, and you can see this yellow area right here. This is the olfactory bulb inside your brain there at the base. And so let's say you drive by McDonald's and you smell their French fries, and it comes up through your nose, and you smell those French fries, and those smell chemicals activate these receptors, and it works its way up to your olfactory bulb, and you go, those are French fries. I'm gonna kind of blow that up. So air comes in, it stimulates these neurons, and these neurons go through these holes in your skull right here. They go right through, and it goes to your olfactory bulb. And COVID can do the same thing. It comes through your nose, it hitches right on these receptors, goes right up through the holes, and now you have COVID infecting your brain. And this is why people have complained about the lack of smell. Okay, that brings us to encephalitis, or brain infection. Cytokine storm, we're going to talk about inflammation. So let's just take a look. Now, you know that the COVID started in your lungs, and your lungs are constantly passing back and forth between your bloodstream, and it distributed everywhere. So COVID is pretty much catching a ride in your bloodstream up into your brain. And then it starts attacking the brain cells or the neurons. If you hear me say neuron, I'm talking about brain cells, a specialized type. This is one of the key ways it gets up into your brain. And encephalitis, just think of that as infection, okay? When you get this infection, you start getting this inflamed brain. And this inflammation can cause severe headaches and confusion. So people who have COVID are complaining about headaches and confusion. What's going on is the brain has been infected with COVID, and it's inflamed. And the same thing that was happening in lungs, our normal balanced immune system is out of control, and it's over here in the red zone. And now we've got this this cytokine storm that's attacking the infection, but it's also affecting and damaging healthy brain cells. And so that's what happens when it's in overdrive, is innocent healthy cells also get damaged. All right, that's going to bring us to cerebral vascular complications, strokes. And I want to spend a little bit of time on this because science is starting to show us that even if after COVID, the initial symptoms disappear, people are still having strokes later. So I want to spend some time on that. And I like this picture here for the stroke, because if you look at this, this is your carotid artery that comes up through your neck, nice large carotid artery. And then as it comes up into your brain, you can see it starts branching out. And every time it branches, it gets smaller. Well, if you've got if you have a blood clot and it's sizable and it comes up through here, by the time it comes up here and starts trying to get into these smaller areas, it could get lodged and cause a stroke. So what that looks like is, now, this is America. We like our high-fat diets, and many people have probably been to the doctor and he tells you you need to lower your cholesterol. They put you on a statin. That's this LDL right here. So most of us already have some fat clogging up some of the artery walls that we have here. This is very common in America. And it makes it harder for blood flow to get through here, okay? And so this is a simplified drawing. What we have here is a fairly clean artery, and blood flows through here. But one of the things that happens with COVID is it makes the blood sticky. We call that coagulation, but just think of it as sticky, and it's starting to form together here on the side of an artery, making it harder for the blood to flow through here. Here you can see a healthy blood flow where things are flowing through nice and easy. And then over here, we've got this thing building up. It's called a thrombus, okay? And it's starting to really plug things up. Now, when part of that thrombus breaks away, we call it an embolism. But for simplicity, we'll just call it a blood clot today, okay? You don't have to worry about a new word there. And so we've got this blood clot that's flowing through the artery. Then it comes to this area it's narrow because it's got this fatty plaque buildup right here. And so it gets lodged, which means there's no blood going to be flowing beyond it right there. Another common thing that we see is when a larger artery branches into smaller arteries, and this is very common in the middle cerebral artery on the left side, where your heart's pumping blood directly up your carotid artery. There's a place where it has to take a hard left right here, and this is about 80% of the strokes happen here in this middle cerebral artery area. So a lot of people were going, well, yeah, but I'm not 70 years old, so I'm not going to have a stroke if I have COVID. And I'm going to challenge your thinking. What we have here is a study that was done in August of 2020. So, our knowledge about COVID, it's real time streaming, if you will. Everything that we learn, it changes day by day, week by week. And so this is a case study of a 59-year-old female. She has no history of stroke, no history of blood clots, no heart disease. She was never a smoker. She doesn't drink alcohol. These are all risk factors that we think of when we think of stroke. So she doesn't have any of the conventional risk factors, except she does have some hypertension, but that's controlled with medication. So her medication keeps her hypertension under control. So she comes to the ER and she has this right-sided weakness in her upper and lower extremities, okay? She's got some tingling, numbness in her right foot. So that's a pretty strong indication there's something going on. She has memory loss, so she's not remembering her children's names. She's not remembering her work schedule for the day. Supermarkets near her house, she just can't think of the names. So these are all indications that her short-term memory is under attack. So she had a mild headache behind her right eye about the same time she had that right-sided weakness. So come to find out, she was diagnosed with COVID-19 2 months prior to this ER admission. So she's already had COVID. She was not hospitalized because it was mild. And she stayed at home. We were telling everyone, you got to quarantine for 2 weeks. So she stayed home, did her 2-week stint. And at the time, she had loss of smell. And now you know why she had loss of smell. She had the achy body, right? And she had that fatigue for a week. And then she felt like she was okay to go back to work. But she did report having that brain fog and memory difficulty. Now, when she showed up at the ER, her blood pressure was not bad. It was 140/80. That's just slightly raised for her age, but it's nothing that would raise an eyebrow. Her BMI, her body mass index, was a 30, which puts her at the bottom right there of moderate obesity. So she's carrying some weight around on her, which means she's probably been eating a high-fat diet. She probably has some arteries that have some plaque inside them, okay? She was awake, she was alert, she knew where she was, place and time, she was oriented. Now, her speech was fluent, but it was what we call word salad. So she was putting words together that made no sense. So when I hear something like that, I'm pretty sure, okay, this is left hemisphere, it's affecting her language region. Different parts of your brain have different duties. And so there's a language region in her brain that has been affected because what she's saying doesn't make any sense. Now, she's also tangential. That means that she jumps from topic to topic. She can't stay focused on task, and she's hard to redirect. So her diagnosis is a chronic ischemic stroke. And I've got pictures of her brain scan. So this is a CT brain scan. These arrows, this is the left side of the brain. I know your mind's saying that's the right, but it's not. It's just the way that it's in the imaging machine. That's the left side. And this area that's dark right here, and this area that's dark right here, these are different slices. This one's a little deeper in the brain. This is a little higher up. You can see the area that's damaged. That dark spot is brain cells that are starving of oxygen. They're not doing their job. And the job of these brain cells right through this area is your motor strip. Earlier I said different brain regions have different responsibilities. And so there's a strip in your brain that is responsible for moving your body. Like if you want to move your right hand, this area right here says move the right hand. Well, we know she has weakness in her right hand. So that's not going to work so well. And also Broca's area is one of the main language regions in your brain. And it's also in trouble right here. It's beside it. And so she's producing words, but the words aren't making any sense. That's what we call word salad. So before I saw the brain image, I already knew that she was having trouble in this area. And earlier I said about 80% of strokes occur somewhere around the middle cerebral artery area. So yes, she's got a chronic ischemic stroke, and that's a sizable one too. I mean, so that was a pretty good sized blood clot that broke free and came up and got lodged in a smaller artery. So again, this is a young woman, she's not even 60. So this case highlights the importance of neurological assessment and timely evaluation of patients who present with COVID and if they're complaining about brain fog. I think we have to start taking it we need to really look at it seriously than we have been in the past. And timely meaning if you can catch it prior to a stroke actually happening, that would be ideal. So Harvard University, I'm sure everyone's heard of Harvard. Everyone's trying to get the message out there and sharing information that they've heard so that we can all learn at the same time. And Harvard Health Blog put this up there with a Chinese group of doctors. They looked at 29 patients that were considered fully recovered from COVID, meaning they were cleared to go back to work. They found persistent impairment in sustained attention. Okay, and they're thinking, well, it's likely due to the lack of oxygen that we spoke about because of the lung function. And they're having these silent mini strokes. Now, silent mini stroke is a small stroke. It's not like that big one you saw on the screen. A silent mini stroke, little transient ischemic attacks, they're about the size of a pepper flake. So you're not even aware you're having one. And they start accumulating, and the frontal lobes are very susceptible for these because of the smaller arteries are fed, the frontal lobes are fed by smaller arteries. You don't have large ones up there. So these silent mini strokes tend to affect frontal lobe, and that's where attention is involved. So again, it's not just people over 70 having these strokes, but young people as well. So a group of German American doctors, they concluded, you know, based on what we know today, you know, you've got the virus and you got the systemic inflammation, strokes, and damage to bodily organs. So, you know, it's not just the lungs and the brain, but it's also the heart and the kidneys and just about any part of your body that needs oxygen, okay, and blood flow. It's going to take a hit to some degree. So they're advising professionals, doctors, lawyers, business leaders. If you've had COVID, you may need to be carefully evaluated with formal neuropsychological testing. I would argue that if you're someone who values your brain function, you don't have to be a doctor or a lawyer. If you know someone that's had COVID and they're having brain fog, I would advise them to look for some neuropsychological testing. And here's why. Because I'm a neuropsychologist, so I can speak to this. If you go to the primary care physician's office and you say, "Doc, I'm having trouble with memory," if you're lucky, because it takes time, they'll take 10 minutes and they'll do a quick little screen on you to see. They'll ask you to remember 3 words. Maybe can you count backwards, list some names of animals and stuff. And then they'll check you to see if you still know those 3 words. And that's about all you're going to get, tip of an iceberg. Now, when you come in for a full cognitive evaluation, that's like looking at the rest of this down here. What's really going on? This takes about 2 to 3 hours to do a full workup, because we're not looking at just verbal memory. We're also looking at visual memory. There's visual attention and verbal attention. There's visual spatial planning, executive function, reasoning. There's psychomotor speed. How fast are you processing information? Can you generate those words? We take plus there's about another hour of clinical interview, collecting your past, finding out what kind of risk factors you have, so we can determine what type of degeneration you've had. Is it the COVID, or is it early stage dementia of some type? And that's something else that we do. So now for those of you that are concerned that, okay, I've had COVID, or my mom's had COVID, is there anything that we can do like right now? And there is. So Dr. Steve Blake, he's a nutritional neuroscience director here at the Maui Memory Clinic with us. His website is drsteveblake.com. He has a book out called Beyond the Mask, How to Survive COVID-19. Dr. Blake believes in nutrition and healing the brain and the body through nutrition. So this is something he knows more about than anyone I've known. He's a prolific author. And I believe he's going to be speaking on this platform, I believe in June. So Dr. Blake is, if you don't want to wait until June, he's got this book available. I believe it's an ebook that's at your disposal. And then I believe I was told that I had 20 minutes and I'm done. However, Gary, do I have time to do a couple of Q&As? Because I've got some frequently asked questions here if you'd like for me to go over them.
Oh, I can pipe in for Gary. This is Leanne. So yes, Dr. Harding, please continue. Gary and I have some questions, and then I'd also like to invite our participants to send in questions via the chat feature. So yes, please continue.
All right, well, you guys are thinking of questions. Here's some of the frequently asked questions that are out there. And that is, how many people who contract COVID-19 will experience brain fog? Yeah. And all right, this is not an exact science. These numbers are changing because we're starting to realize that a lot of states underreported deaths and Also, if people don't go to the hospital, how do you know if they had COVID? So these are the numbers that we're aware of. It seems like about a third of the patients will have some type of neurological illness associated with COVID. And that the brain fog, the memory issues, the seizures, strokes, neuropathy, that type of stuff. So about a third, and a good chunk of those are probably the ones that ended up in a hospital that we are aware of. Another question is, how long do the symptoms from COVID-19 last? And this, again, this is still being studied, but we know that a third of the people will have complete recovery with no issue. So that would be someone that had some mild case, probably didn't go to the hospital, okay? Another third will have lingering effects that improve after therapy and time. And then another third may have permanent effects, especially if they've been into the hospital, have been intubated, or if they've had multiple organ failure. Now, if someone's going to improve, they should improve within 3 to 6 months after recovering from the infection. If they don't recover within 6 to 12 months, at this point, they're saying that it's likely something they'll be dealing with lifelong. So I believe what I would focus on if I'm one of those people that's going to recover after with therapy, you know, that would be coming in, being assessed, changing diet to get some of the information that Dr. Blake has out there for boosting your immune system. That's the type of stuff that probably would respond to therapy. And, you know, they're also talking about, you know, how can you predict, you know, how severe someone's case of brain fog would be. And that depends on a number of things, but from a brain perspective, it depends on someone's brain reserve and severity of the illness. So, you know, brain reserve, you know, someone that's got more brain cells to go through versus someone that doesn't. And then, of course, the severity of the illness. Did you end up in the hospital versus, you know, where you were at home? However, remember that case I shared with you, that gal had COVID, she stayed home for 2 weeks, but she still had a stroke 2 months later. Okay.
I have some questions in the chat, Dr. Harding. So let's see, one is, does COVID-19 predispose individuals to dementia?
Yes. So if you think of risk factors for dementia, artery health and lung health are two big risk factors. So someone that smokes for decades on end, they're going to have poor lung function, which means you're not going to have high levels of oxygen go into your brain. And if you don't have enough oxygen go into your brain, those brain cells these are brain cells that have to last for decades because most of them don't replicate like skin cells. And so if they don't have optimal nutrition, optimal oxygen to do their maintenance activities, they're going to die off sooner. And so, yeah, that's one of the things they're saying is you're at a higher risk for dementia right here. COVID survivors are at a higher risk for dementia in the future. Absolutely.
And then another, as people are recovering from COVID, what are some of the symptoms to watch out for? To indicate some brain, you know, brain correlation.
So some of the symptoms that you can say this might be brain fog, right? So that would be some of these that we were speaking about up here from the very beginning. And these symptoms that you want to look out for is, are you having trouble with attention? Is your memory giving you a hard time? Are you having a harder time than usual? I mean, is it, you know, a lot of folks have senior moments, but are those senior moments happening more frequently? Word finding problems, the fatigue, the loss of smell, the hyposemia, right? These are all things that you want to keep an eye out for. Now, you're not going to know if the brain infection, you're not going to know this, but this reduced oxygen to the brain is hypoxia. You're not going to feel that, but it'll show up in a way where your memory is not working as well as it should, okay? But the main ones that you want to be concerned about is the headaches, the confusion, the memory, the attention. If you're just feeling like I'm just not firing on all cylinders like I was before I had COVID, it's time to go to the doctor and let them know, because the more we can know that something's going on with a patient, the sooner we can act on it.
Mhm. So I would think that with some of these symptoms that a COVID patient and family would first go to their primary care physician. But,
Yes.
you know, do you
And that's
think
where you
the
want to go.
PCP would then direct the COVID person to a neuropsychologist? And why is this area the more appropriate area, you know, the more appropriate physician to then do
Sure.
evaluations?
So you are going to, your first stop in the healthcare industry to go to a specialist. So a neuropsychologist is a specialist, and you don't just get to come see us without first stopping off at your PCP. Usually you need a referral. And so if the PCP does this little 10-minute screen and realizes, yeah, you are having trouble, you're going to probably need to tell them, I would like to go and get a cognitive evaluation in order to trigger that, because you know, this is happening in real time. A lot of folks just aren't aware of the brain fog and how serious it is and how it can affect strokes. I mean, it's so you would probably after you go to your PCP, you're going to need to come in for a full evaluation, because a 10-minute screen is not going to tell you anything about your processing speed, which is affected by small vessel ischemia. It's not going to tell you about your visual spatial area and your right parietal, because that's not what it's testing for. It's a quick little simple memory test. And if anything else is being affected besides memory, that screen is not going to pick it up. That's why you want to come in here and have a full look at what's going on.
Is there anything that a person can do to help limit the damage to the brain from COVID?
Yes, and that would be start educating yourself on some of the foods and nutrition that can help strengthen your immune system. So when you get this inflammation in the brain, you have this cytokine storm, you want to try to reduce that as quickly as possible. And Dr. Steve Blake is going to talk about that in June. Or you can start, if I was concerned about it, I'd get the ebook and start reading it so that when he starts talking, I'll be able to keep up. Dr. Blake has to get into the neurochemistry, and that's usually beyond most average folks. I mean, I wouldn't know half the things I know today had I not spoken with Dr. Blake about it.
And how can our participants get Dr. Blake's ebook? Just going to the website that's on the slide?
Yeah, and Dr. Blake, are you on the line right now?
I think he is.
Okay, he may have stepped out. But yeah, you go to drsteveblake.com, and he's got lots of stuff up there. He's, as I said, he's a prolific author.
I am.
There he is, Dr. Blake.
Fantastic.
People are asking about how they would be able to find your book. I mean, they just go to your website. Is there a certain page they go to?
Oh, thank you. If you go to my website, drsteveblake.com, it's in the top 3 books there. And if you look down, there's about 25 more books that I've written. But the book on COVID-19 is, you can get it for just $10. I have an option for you to spend $25 to get the exact same book. And some people give extra support for my authorship, but 10's fine. And that way you get the full book, and I just updated it. It is in the 4th edition, and it's less than a week old right now.
Wow. And that's how fast our knowledge is changing of COVID.
Yes.
It's been a year and he's already got on the 4th edition. That's incredible.
Well, I wanted to add information on how to boost vaccine effectiveness, because elders tend not to respond to vaccines with a good antibody response due to age-related loss of immune function. But this can be reversed with proper nutrition. And that's really exciting, because then not only can you respond better to the vaccination and build lots of antibodies and T cells for if you do get infected with COVID-19, but you can also help ward off other infections like the flu, which is kind of a big hazard for us too.
So, there's a question. What about using cumin, vitamin D, other kinds of supplements? Will that?
Well, those are all good things to use, and I do cover them in my book. I base my book only on peer-reviewed scientific evidence from medical journals. So I will give you the evidence, and there are about 150 citations to studies in journals, so you can always look further. Curcumin, and which is from turmeric, the spice turmeric like curry, and also vitamin D is very important. Even in Hawaii, it's important. And there are many other things. We've all heard about zinc. And basically, I cover the most important nutritional things that we need every day and how to get them. And also, there's some spices and herbs that block the COVID from being able to infect us. There's other spices and herbs, common spices that we use in cooking, that can block the replication of the virus so it can't get out of hand. And I do talk a lot about the cytokine storm and how to keep inflammation in our bodies down, which is helpful with thinking on the brain. It's helpful with arthritis, but it's also very crucial right now to keep away the cytokine storm during COVID-19, which has claimed so many lives.
Well,
Dr. Blake, I'd like to ask Dr. Blake a question.
Yes, thank you.
So, Dr. Blake, if I've been vaccinated and now we have these different variants coming over, and if I'm concerned that my vaccine may not quite keep me safe, so some of the things you're telling me about the antioxidants, vitamins and minerals, I can add that to boost my vaccine to keep me safe. Am I thinking right?
Well, the vaccine will protect you specifically against produce antibodies against the SARS-CoV-2 virus that causes COVID-19. But it won't specifically boost your immunity, perhaps to some of the newer variants or to other viruses. So an overall approach of boosting immune power, I think, makes a lot of sense. And I certainly do it in myself. I don't want to get ill, and it works. It's amazing. Sitting in tiny consult rooms with lots of people, it seems that if you keep your immune system really strong, you don't tend to get sick. And let's face it, colds and flu and all that is a big waste of time and kind of miserable anyway. And then, of course, we have the big one, COVID, to deal with that we definitely don't want to get a bad case of.
Well, I want to thank Dr. Blake for sharing with us. It's a little tasty tidbit. He'll be speaking to our caregiver support group on June 15th, so please save the date. But turning back to Dr. Harding, there's a question in the chat. So not only do you recover from COVID, but you could have permanent brain medical issues that would require long-term care depending on the individual. So COVID hits the brain overall?
Well, they're saying that about a third of the people that end up in hospital may have some type of long-term problems that they have to deal with. And the numbers aren't solid, really. I mean, these are the numbers that they're showing up right now. But they're saying if you're not making any improvement in 6 to 12 months, whatever problem or symptom you're having, it might be something you deal with lifelong. And certainly if you've had a stroke, if it's a big stroke, you've probably seen people, out and about with a stroke, and you can tell because they've got some paralysis on one side of their body. And that may have happened 10, 12 years ago, and they still have it. So depending on what COVID brought to you, whether it's a stroke or if it was just temporary brain fog from the infection that you can reduce quicker, according to Dr. Blake, with proper nutrition, right? So a lot of it has to deal with the person. Are they proactive? So if you've got a high-fat diet, can you start right now changing the diet and remove some of the plaque in your arteries? And the answer to that is yes. Dr. Blake's put me on a diet, and I've dropped weight, and I feel like I've got cleaner arteries. And Dr. Blake, by the way, is available for counseling at the Memory Clinic. So if you feel like you would like to have some personal counseling with him, he is available. And he's helped me drop the 5 pounds that have plagued me for over a decade. I just couldn't lose them. So I changed my diet, I listened to him, and I have lost them.
Okay, and I'd like to draw everyone's attention to the screen. If you'd like to get in touch with Dr. Harding, there's his email address at the top, phone number in the middle of the slide, and also the website at the bottom. And Dr. Harding, just one final question. This is just so mind-blowing, no pun intended, about COVID's impact on the brain. And how can we get the word out to our friends, family, the wider community?
Well, that's a good question, because we've been talking about wearing masks for a year. And I think half the population wear them, the other half do not. So unfortunately, it's been politicized. And so for the ones that are wearing the mask, I think they'd be more receptive to the message. And that is, it's not the flu. It's not going to just affect your lungs a little bit and go away. This can affect your brain. It can affect your kidneys. It can affect your heart. So it depends on the person, and are they willing to hear the message? I think I don't know if you guys have been watching the news these past few days, but spring break down in Florida right now, it's crazy. I look at all those young people, no masks. When you're young, you're invincible. It's not going to hurt me. But then they're going to get on a plane, they're going to spread it in a plane in the airport, take it home to their grandparents or parents. Who knows where it's going to go from there? And it's why the CDC is concerned about this very week and it being a super spreader is are people listening to the message? And, they don't think it's going to bother them. It's just a flu. I don't know how receptive they would be to think, well, this could hurt my brain, because it's not really spoken about that much in the news media, but it's starting to gain traction because more survivors are complaining about this brain fog. So I think it's just a matter of time before people start taking notice. And unfortunately, for many, it's going to be too late.
Well, I'd like to thank Dr. Harding and Dr. Blake very much for speaking with our caregiver support group. And to all of our participants, this is a monthly event on the third Tuesday of the month at 4 p.m. Hawaii Standard Time. So mahalo, Dr. Harding, Dr. Blake, and to all of our participants.
Thank you for having us. And it was good to see the folks over, the Tsutsumis over on Oahu. Stay dry.
Thank you all.